Today I am going to present the topic the scope of social work practice linked to ICDS, preschool education and adolescent mental health. In this presentation, I will explain how social workers contribute to the development of young children and adolescents through ICDS services. Introduction. ICDS stands for Integrated Child Development Services. It was launched by the Government of India in 1975 to improve the health, nutrition, and overall development of children. It also provides support to pregnant women, lactating mothers, and adolescent girls. The services are mainly delivered through Anganwadi centers. The main goal of ICDS is to ensure that children grow in a healthy and supportive environment. Objectives of ICDS is to provide nutritional and health status of children, women, lactating women and adolescent girls, and to promote psychological, physical and social development to reduce child mortality and malnutrition. In the next slide, we will be discussing about the key services under ICDS. ICDS provides supplementary nutrition that provides nutritious food to children, pregnant women and lactating mothers, helps to prevent malnutrition and improve growth. Then immunization protects children from disease such as polio, measles and tuberculosis and conducted in collaboration with the health department. And health checkups, regular monitoring of children's growth and health, identification of illness and developmental program. Then referral services, children and mothers requiring special medication attention are referred to hospitals or specialists. Then the nutrition, health education and preschool non-formal education also provided. In the next slide, we will be discussing about the preschool education under ICDS. Preschool education is a non-formal education program which provides through Anganwadi centers for children aged 3 to 6 years. The objectives are development cognitive abilities, enhance social and emotional development, encourage creativity and curiosity, and to prepare children for formal schooling. Activities like storytelling, singing and rhythms, singing and rhymes, drawing and coloring, and educational games, and also group activities is conducted. In the slide 5, we will be discussing about the role of social workers in preschool education. It is a child-centered role, that is, the social workers monitor children's attendance and participation, identifying development delays and disabilities, ensure child protection and child rights. Then family-centered roles in which conduct parent educational programs, guide parents on positive parenting, then address family problems that affecting child development. Then community-centered roles such as create awareness about early childhood education, then encourage community participation in Anganwadi activities. In the slide 6, we will be discussing about the social work interventions in the preschool education. There is home visit to understand family conditions and to monitor child care practices. Then counseling are provided, guide parents on nutrition and child development and to address behavioral concerns. Then advocacy to promote children's right to ensure equal opportunities for all children. Then referral services to refer children with disabilities or developmental issues to specialists. Then community mobilization is to encourage local participation in child welfare programs. In the 7th slide, we will be discussing about the adolescent mental health. That is, adolescent mental health refers to the emotional, psychological and social well-being of young people aged to 10 to 19 of years. The importance is to influence education and academic performance. It affects relationships and social adjustments and shapes future adulthood. The common mental health problems such as anxiety, depression, stress, low self-esteem, substance abuse, behavioral issues, suicidal thoughts can be prevented. In the next slide, we will be discussing ICDS and adolescent mental health. It supports through ICDS like nutritional support for adolescent girls, health education programs, menstrual hygiene awareness, life skill education, awareness about emotional well-being. Then the objective is to promote healthy lifestyles, prevent mental health problems, build resilience and coping skills, then to improve self-confidence. Then the role of social workers in adolescent mental health. One of the main role is preventive role, that is conduct awareness programs, then promote a healthy coping strategies, then teach life skills and stress management. Then curative role, that is provide counseling services, identify mental health concerns early and facilitates referrals to mental health professions. Advocacy role such as reduce stigma related mental illness, then promote adolescent rights and well-being. Then the next slide we will be discussing about social work practice methods used. Social workers practice is used. Social work, individual counseling, assessment of personal and family issues, crisis intervention, then social group work, peer group supports, and life skill training, adolescent clubs, etc. Community organization, awareness campaigns, parent meetings, schools, and community collaborations. The next slide we will be discussing about the challenges faced. Individual level is the lack of awareness about mental health, low esteem, confidence among the adolescent. In family level, there is family conflicts and neglect of poor parenting practices. In the community level, parental health is present and gender discrimination. And in institutional level, there is limited resources, shortage of trained social workers and counselors, and weak referral systems. In the next slide, we will be sharing the recommendations like strengthen ICDS services. We can improve infrastructure and resources, increase the availability of educational materials, then capacity building, that is train Anganwadi workers in child psychology and basic counseling to increase, and also to increase the number of social workers in ICDS programs, and mental health promotion to conduct regular awareness programs, and also to integrate mental health education into community activities. And better coordination has to be improved, like strengthen collaboration among the schools, health services, NGOs and ICDS centers, etc. And community participation to encourage active involvement of parents and local communities. In conclusion, we could say that ICDS plays a vital role in child development and adolescent well-being. Social workers contribute significantly through education, counseling, advocacy, and community mobilization. Strengthening social work interventions can improve preschool education outcomes and adolescent mental health. Thank you.